Well, I'm wondering, is there anything that we could even start just a discussion? I mean, we could certainly introduce Anna or something like that, if that would be, so we're not, I feel like we're all just kind of sitting here like, oh, what do we do? But so if that's okay, but I'll just give you a little bit of background on Anna. She's our newest employee. She's, I guess technically this is her 1 month anniversary. She started on December 20th, and Anna comes to us from the village of Niles, and where she was a management analyst, and she has a range of experience in community development. She staffed the Building and Zoning Commission there, and also their Economic Development and Neighborhood Renewal Commission, which really dealt with economic development, TIF, and housing stock. So she's got a broad range of built environment experience, but she also has social services experience from a prior job, community coordinated childcare, where she was specifically working to address language barriers with Spanish speaking and other non-native English speakers in accessing childcare and helping with that need. She's done a lot of, as an analyst, of course, she's done lots of data analysis and worked on recommendations to improve processes. She's been the FOIA officer for at Niles. Prior to being at Niles, she was at Elk Grove Village. Anna is a graduate, both her bachelor's and her master's from Northern Illinois University. And she is fluent in not only Spanish, but also, and English, of course, but also French and Portuguese. So way more languages than, I'm one of those people, small Latin and less Greek. I actually took both of them, but it was still studying the dead languages, So anyway, we are just thrilled to have Anna on board with us. She's becoming our home investment partner specialist. So that's one of our HUD grants that is the other committee has primarily responsible, but also with that home grant is our tenant-based rental assistance program, which is a combination of housing supports in the format of rent assistance and social services, wraparound social services. It's managed, it's implemented by Connections for the Homeless. And so they have a really rigorous case management process with the families who are in that program. And the focus of our TBRA program is families with children in the Evanston schools who are homeless or unstably housed. And so there's a lot of crossover. And in a way, the TBRA program, I remember early on when we were presenting this concept of what we've now done with that the Social Services Committee is responsible for, the case management, supportive services, and safety net services. When we were talking about the need for really strong, robust case management to really help our individuals and households with greatest needs access what they need, Council Member Revelle said, that sounds kind of like our TBRA program that's been really successful. I think this is really, and we said, yeah, it is expanding to not everybody needs housing as well. There are just a lot of different, situations where people need different things. And of course, some of the people who are in case management services need housing as well as all the support services. But so that was kind of how we got to this. And so Anna, with her range of experience, can step right in. And we're working on different things. Our group is also starting to take on responsibility for some of the ARPA funding and planning for that. And so Anna is going to be working with me and community members on a welcoming center that's focused on our Latino population, but also on other immigrant or recent people who recently come to this country. Yeah, there I think there are 32 welcoming centers statewide, and they've been really important to helping people who have language differences and cultural differences to understand our processes. And our city clerk, Stephanie Mendoza, is going to be very involved in that. And also we have a large array of Latino organizations that we hope to pull together into a more cohesive service providing process, shall we say. So that's something that we'll be working on. So there's a lot of crossover between all this stuff. And Jessica is also, from an ARPA standpoint, working with me and the Evanston Early Childhood Council on defining their needs and the things that ARPA can be used to help get childcare back up to, at least the level it was, because they are really struggling with a combination of things. They have trouble getting workers, all that sort of stuff. But so we've got more stuff. And we actually asked City Council if they wanted, or our recommendation was that some of these, as we work on these things, should maybe come back through the Social Services Committee, come to the Social Services Committee for sort of vetting before we take it to City Council. And they didn't absolutely say, yes, we want you to do that, but there was sort of head nodding going that, yeah, the bricks and sticks stuff probably should go to the Housing and Community Development Committee, and the services stuff probably should go to, so we'll see how that works out and how timing works out, but we will definitely try to keep you apprised of what we're working on that, because it is very much, it has to dovetail and work with what we're already doing with these funds. It's very critical that we don't just have everything kind of out there spinning out of control without doing that. So that's maybe what we could do, is just give Anna a little bit of a chance to say something. So we're waiting. I don't want to.
Thank you very much, Sarah, for introducing me. And it's very nice to meet you all. I'm very happy to be here. And if I can be of any sort of help, please let me know. My email is just first letter and then my last name. So it's kind of hard, Elisa. But please reach out and I'd be happy to help.
Sarah, Chair, I'm also happy to talk about reports that have been submitted in Zoom grants. And I can give a little detail or a lot of detail depending on the committee's interests. So I just put that out there while we're waiting.
Well, I guess one of the things, I want to look at participants to see if anyone is by any chance, any of our, no, those are all not, and no committee members by accident in the, I'll have to check for that. So yeah, I mean, if I think that makes sense, we can at least do that. And then I don't know at what point we decide if we, we can't vote on anything, but I don't see why some of the stuff couldn't be discussed. I mean, I hate to have all of you here and not at least make some benefit and better use of your time. So Jessica, why don't you talk about what the working group is?
Oh, so sure. The working group actually, and we have both members of the working group. My apologies. I'll present my screen and jump in.
And should we call the meeting to order and go through roll? I recognize we wouldn't have a quorum, but if we could add some, does it matter to call the meeting to order if we don't have a quorum?
I'm not really good at all those technicalities, but why don't we just do it? Because then I think it at least shows that this is where the real discussion of anything relevant, starts. And this would be where we'll post from this, maybe from this point.
I think we can call to order and discuss and just declare that we don't have a quorum, so there won't be any voting going on.
Right.
Yes. All right. Good evening. I will call the meeting to order and we'll go through attendance or role. Samantha Olds Fry is here.
Would the other committee members just like to state their name for the record? I'm happy to call. We can, Amanda.
Amanda Angola is here.
Thank you. Derek
Yeah, Derek Ohanian's here.
and Councilmember Burns.
Yes, I'm here.
Wonderful. We do not have a quorum. We only have 4 committee members at this time. If we have a 5th, we will make note of that. But given that we will not be able to take any official votes, which means we also can't motion to, I can motion to suspend the rules and have the meeting virtually, but we can't actually vote on it. And with that, though, for non-voting matters, we'll move to Jessica doing a reporting on the working group, the Zoom grants working group update.
Thank you. So, yep, the working group consisted of Chair Olds Fry and Councilmember Burns. And we had an initial meeting on December 15th. It was a phone meeting to talk about the structure of the case management report and the safety net report. So additions to the case management report included defining the 3 hardest referrals to connect participants to during the report period, and capturing the approximate number of participants requesting services, and then any challenges to receiving those services. And then for the safety net report, the working group agreed to further capture information around the types of additional services participants were referred to, the numbers referred to case management, and where participants were referred. So I'm actually now going to jump out of this. Hopefully I'm still sharing my screen. Is that correct?
Yes.
You are.
Okay. So this is just a quick outline of the case management, the questions on the case management services report. And I can send this around to committee members should people want further review. I can include it as an amendment to the packet. But this is really just administrative so that people can again review the questions. To provide a high-level review, we capture the number of participants enrolled at the end of the prior year report period so that we can consider how many new participants we have in the calendar year in the report period. The number served, family income, special needs, race, ethnicity, and age information. We have to capture to comply with our HUD reporting requirements. And then as I scroll down, so 13 through 23 are again questions that have been, 13 through 24 are questions that have been added by staff in the committee. So again, really trying to drill down to understand for case management, the number of contacts in any given report period, the number of new service plans created, support service referrals made. We don't, for these first 2 reporting periods, support services accessed with city funds or service payments will not apply, but we kept that in with a thought that we could track through our Zoom grants reports any referrals that participants are connected to with the assistance of support services funds. We also wanted to capture the number of participants who disengaged from services in the report period, the number of service plans that were successfully completed. And then again, 22 was the question that captured the most difficult referrals to connect participants to. And then we have narrative information. So agencies can let us know more about any challenges, accomplishments, referrals, partners, anything else. Are there any initial questions or thoughts about these the questions for case management agencies? Okay.
I was gonna say, I really like these.
Oh, great.
Yeah, they're gonna give a nice narrative of, help us understand what the experience is like for the agencies. These are great.
Great. Thank you for that feedback. Okay.
Yeah, I
so
think
then
this is, oh, sorry. I
No,
was
I'm
just gonna say,
sorry.
I think this is really thorough, and I think captures a lot of dimensions that we would be interested in finding out about. I had two questions though. One being, as far as the demography information, Jess, that you said capture, that's 1 through 12 that you're required to capture.
Yes.
Are we allowed to add to that demography information, or is that fixed? Sort of that 1 through 12.
No, we could add to it.
Yeah. Well, the only thing I was just thinking was kind of thinking of like census data or census forms. I don't, if there was something on education, potentially, just to see if that's an interesting factor for anything, for like highest education attained or something like that.
Okay.
Just to comment, one of the things that we frequently are doing, I'm sorry, I put my camera off so I wasn't distracting from the speaker. Now I can't get my camera on anyway, but frequently in the case management process, of course, they'll learn about education levels, because one of the things I know from our TEPR program that frequently we talked about was additional education needed and stuff like that. So that's something I think we should be looking at, and we maybe will be able to capture it in some way, shape, or form. It frequently links into how what kind of education people have can also link into what kind of jobs they can get frequently. So sorry, finally got this on. So that's a really good point. Thank you.
Yeah, and the second thing was, is there anything, I guess, from the questions that were added 13 through 24, is there anything that hints at somebody disengaging from a specific case management agency and switching to another one for any number of reasons? Sorry, my dog is losing her mind.
That's a good point. No, we asked about successful completion of plans and disengaging from services, but in terms of tracking participants, if they were to move from one agency to another to receive case management services, we don't have a way to capture that.
Okay.
I'm sorry, I'm going to take notes and then can think about how we would do that.
Although we probably very easily could have somebody who's terminated who terminates without really fulfilling their case plan. And so there might be a way we can try to track that. I don't know how often that will be a case, but it would be interesting. I hadn't thought of that if somebody moves from one agency to another. And we do have some agencies that work very closely together.
Mm-hmm.
I suppose that could be a possibility, and we want to make sure that they're not getting duplicated services, of course, but
Yeah. Yeah, that's a very good point. Can I move on to safety net, or are there further thoughts or comments about case management? Okay, I'm going to move to safety net. So again, the safety net report questions are similar. We're looking at the number of households that were enrolled in the prior year, so we can measure how many new households received services or were engaged in services in the current reporting period. And then, again, 2 through 11 are those our standard HUD questions, and we can consider adding or think about how we could add education to this section also. And so then the questions that sort of dig a little deeper into these services are 12 through 20. We're looking at whether Evanston residents were turned away from services. Again, this is to measure agency capacity to see if city funds, one of the hopes with city funds is that city funds are used to increase capacity specifically for Evanston residents. We know that a lot of agencies don't try very hard not to turn participants away, but that the wait time for services can vary depending on funding. So I'll pick on C&E and use them as an example. Anyone who needs C&E's Learning Together services received those services, but depending on the funding available, participants might have to wait a longer period of time before they are seen by therapists or before they receive services. So we're asking about, again, whether participants were turned away and length times. We do have agencies provide a narrative report to talk about, again, the number of service hours and the types of services or any challenges to service delivery, whether it was staffing or financial. We are looking at the number of participants enrolled in either case management or additional services within the agency, as well as the number of participants who are referred to external agencies or for services outside of the agency. We're interested in who those referral partners are and the services that they provide. The number who end up in case management, if that's an option. And then again, the number of participants who stop receiving services. And for safety net, it wouldn't be necessarily like a graduation or a successful completion versus a voluntary termination. It's just people who say they no longer need the safety net service. Any thoughts or questions about these additional report questions for safety net?
One of the things we're really hoping we can get are people who are identified through the safety net services that really need deeper services and ensure that they get those. So that's something that I'm particularly interested in seeing if we can track and also determine what level of case management services we need, which is another challenge. And of course, it may fluctuate over time, but it will. But really try to balance the when have we hit the when have we gotten the capacity that we really think we need to address the needs we're working on. So.
Okay, so then the working group, again, Chair Oldsfry and Councilmember Burns, met with case management agencies. It was a virtual meeting to kind of hear feedback on January 5th. And I just wanted to take this opportunity, Chair Oldsfry, Councilmember Burns, please feel free to jump in to share any feedback that we received from the agency. For case management agencies, there were some challenges identified with recording and tracking support service requests and referrals. There were questions around participants who maybe make multiple requests, either for the same service or for additional services, and how we could how the committee wanted to review that information, whether we were looking at the unduplicated count of support or additional service needs, or whether we were looking at volume. And agencies are hoping that the committee would consider approximations and not necessarily look at specific numbers. So I'd like to pause for a minute and sort of get the committee's feedback so that agency representatives who are participating virtually can gather thoughts.
And part of it, this is Chair Oldfry, Samantha Oldfry, part of the reasoning was of how they've tracked that. In order to get individuals, they would have to go through manually each care plan. And so it is all documented. So from an auditing perspective, that is covered. It's simply that it's not necessarily, especially for last year, when we hadn't asked the agencies to report like this, they tracked the requests themselves, but didn't necessarily identify them to a member, or sorry, to a specific resident. And so that is some of the challenge. So it's not that there isn't documentation, it's that to report on this, they would have to go through each care plan. And that manual process also, of course, can also lead to some errors. So that was for the interest in the approximation.
Yes, thank you for that clarification.
I just want to say, this is, excuse me, Councilmember Burns, that I think where I went at this time was recommending that we identify, and this is more, looking forward, identify a subject matter expert who can help agencies collect and report out on data to meet our new standards. I think it would help across agencies to have a bit more data, especially in terms of referrals, because I think that's the area we're trying to make a big difference in right now. So understand where we're, what needs aren't being met, and how often these referrals are made, and how often they're fulfilled, and how long it's taking. I think that's the bulk of the work that'll help us get to where we are today and where we want to be. And so I think identifying that person that can look at each agency and the program they're using and either recommend that they use a different program, or maybe even help them understand how to use their current program to collect some of this information. Because if we can put some of these things in a drop-down pick list, then they don't have to, they wouldn't have to go to the notes, and this was a challenge in another conversation I was having, but the issue is that whatever you put in the notes section of your CRM, you can't report out on that. Yeah. You can only, run reports on information that's collected in a drop-down pick list format. And so the more we can get our questions loaded up on those pick lists on the different CRMs, the more easy it will become for them to access that information. So, and that's work that that's something I agreed to take on, obviously with, the council of, staff, is to look into who that person or organization may be that can help us with that. But again, that's more looking forward than it is. I don't think we can apply that now to our agencies, but just looking forward.
Yeah, if I could add, because you bring up a lot of very, very good points. One of the challenges that I've heard from agencies is we can classify support services in buckets like mental health or transportation, but sometimes the requests for support services get very nuanced. So under transportation, for example, it might not be just a request for bus cards or passes. It might also be a request to help pay parking tickets or for car repairs. And so how much can we ask agencies to really drill down in these support service buckets before it becomes really, really challenging for agencies and really burdensome. And it may be that if the committee's focus is, for now, specific to mental health needs, maybe it warrants further discussion by the committee as to what those mental health needs could look like, so that agencies could provide more detailed information around mental health needs, whether it's for individual and group counseling, medication management, psychiatric services. And I'm just pulling those off the top of my head because those are the needs I've heard agencies express the most interest in. But
I like that idea. I mean, it gives us a place to start, and it's relevant because it's the area that we decided to focus on as a committee. So I like that idea personally.
I also like the idea of just having a starting point, and I think it's challenging, right? Because when you're working in an agency, obviously there's documentation required and funding sources that need to, have requirements and things, and those are very important. And, it's also challenging when you have that, some might call it minutia, having to kind of document these very finite things or these very specific things. And sometimes that can take away from like the care of, the clients or the residents. So I really I like the idea of just having a starting point, and maybe in the future, as you were saying, Councilman Burns, like having a pick list, which makes it simple and easy to kind of document that. And sounds like something down the road, but for now, maybe just being able to do some approximations because of those nuances, or just because of, just trying to focus on the people. I think that would be a good place to start.
And I realize, Jessica, I'm nodding my head and you probably can't see me.
No, but thank you. I can't see anyone. Great. No, I think this is great feedback. I appreciate it. I'm taking notes. Any more discussion about the case management session? Okay. Great. Then we also had the opportunity to talk to our safety net agencies on the 7th. And things that came up in that meeting were a request for more specific definitions around the terms that we were using. And I don't think that this is a surprise to social service committee members. The social service committee had noted that we needed more clear definitions. But like, could deeper services be defined as additional services instead? Or what do we really mean by deeper services? More clarity around this but-for rule. And agencies also brought up whether or not this could become a multi-year grant, which it sort of has, just given our timelines for 21 and 22. But I think there's a lot of potential discussion that the committee can have around these ideas. And then again, going back to data collection, this came up with the safety net agencies also. It is challenging to sort of standardize reports and to report information about safety net services when the services themselves can be pretty varied. And specifically, there was the challenge of reporting based on our calendar year, the city's calendar year, and that's how we ask agencies to report. And then the sort of academic year, because we know that some of our agencies do provide services to school-age children, and so they're reporting gains sort of mid-year, and then starting with arguably a whole new population sort of in fall when school starts up again. So, oh, and then finally, multiple services to many people within a single household. I think that this is a good point too. Agencies that start off working with one member of the household, let's say a child, but then also end up providing different and additional services to other members of the household. Would that be considered services to a single household, or would they be services based on each individual in the household? And so that's something for the committee to consider. Okay. Thoughts or questions or anything to add about the safety net discussions?
There is a comment from one of the attendees
Yes.
in the chat. She says, this is why we need coordinated wraparound services.
Agreed. And that really is what we're trying to do in our small way here. Okay. All right, so I'm going to stop sharing my screen. This was the point where we were going to have, oh, there we go. There you are. Okay. So this was when we were going to talk about support services. And so I'm not quite sure. I will defer to you, Chair Olds-Frey, because it's a challenging conversation to have without a quorum. Oh, I'm sorry. No, I can talk about Zoom grants reports and information that we have so far. I'm sorry if I could take up another minute of the committee's time. So of the 5 case management agencies that we funded, we did receive, let me say, 3 asked for extensions and were granted extensions. Family Focus submitted a report, but I had to return it for some clarification. And then Moran Center's report is in. Report components, as we've kind of discussed, included numbers served, service plans created, updates to those plans, referrals and referral partners, and then outcomes, which include successful graduations and voluntary exits. Of our 10 safety net agencies, 7 were able to complete reports, and those 7 included Books and Breakfast, Connections, Child Care Network of Evanston, Interfaith Action, Moran Center, and North Shore Senior Center, and the YWCA. 3 requested extensions. So the 3 requesting extensions are Meals on Wheels, Peer Services, and YOU. The report components for safety net agencies include, again, numbers served, service hours and types of services, referrals and referring partners, information about enrollment into case management and deeper services, and then exits, people who exited services. The second round of reports are due at the end of this month. A little bit before the end of the month, actually. They're due tomorrow, but then we've got some leeway to work with agencies. And part of the reason reports are due so quickly is because, okay, sorry, we need to provide information about the program year to HUD. And we can chat about that, but we do have our end of the year CAPER, our Consolidated Annual Performance and Evaluation Report, due to HUD in March. That report will be available and open for public comment in the beginning of March. And that public comment period will close at the Housing and Community Development Committee meeting March 15th. I was going to save that for staff report, but now you guys have everything in the kitchen sink for me. So
And we appreciate it.
Yeah, unless people had more questions about reports and details, which I am prepared to answer to the best of my ability, that was it for me. That's it for me.
I did get an email back from Demita, another meeting ran long. And I said we were going to be wrapping up very shortly, I think, because I don't know that she will be able to join us because I'm not sure if it's still in progress but I think everything else we were going to talk about officially needed, we wanted to vote, but I think we can still ask if anybody has any questions about them, if there's any more information or anything you would like us to maybe have for the next meeting to make it, or to provide any more information so we can.
I can read through the agenda items and see if committee members have questions, unless others already know they don't, then there's no need to.
Right. We had talked about forming a working group to really dig into the support services, which I think would be really helpful. And then, but just if anybody has any questions about the other recommendations, or wants to email us or anything like that, and to get any more information for the next meeting, we'll be happy to do that.
Yeah, and I just want to say, I think we're handling this perfectly, because I'm a little unclear on, even if we start giving, general direction, not necessarily, taking official action by way of a vote, but even general direction, how that would be interpreted. So I think we're handling this appropriately. And if there's any questions, but yeah, we should probably be careful. I was about to text Nick to see if he could join us, Council Cummings. But yeah, I think we should be careful until further notice from corporate counsel.
Yeah. So I guess.
Well, then perhaps we.
I don't know if it would be appropriate to see if anybody, I don't think that there's anything that would preclude us from hearing any public comment if anyone had any. We've had some people who've been here and listening, so I just,
Yeah, I wanted, if Allie was available, I wanted to hear her fully express what her thoughts were. I don't know if we can make her a panelist temporarily so she can make a comment if she wanted to speak.
Hi, I'm here. I'm already in my jammies, so I think my camera's off, right?
Yes, it is.
So yeah, I'm a district-wide school social worker in District 65, and I talk about wraparound services like all the time. My new position this year is actually dedicated to coordinating wraparound plans for District 65 students, and so we are, we're kind of building this as we go along, but there are a lot of models for wraparound services around the country that we've been researching to try to figure out how to do our job. And I actually just spent a couple days in the last couple of weeks in a training with Wraparound Milwaukee, which is a really comprehensive program that's been around up there for about 25 years. And they have like a braided funding model where they have funding from the county and from the state and from the city and from Medicaid. And they've created this basically a HMO, where if a child gets referred for wraparound services, they are able to access medical services, therapy services, crisis services. The family gets support. They have recreational activities. They're in coordination with the school and with other agencies. And I'm excited to learn more about what they do and see if there's any way we can replicate that here in Evanston, because we do have efforts in place to coordinate wraparound services. We meet monthly with the local area network of social services, Land 40. There's the mental health task force. There's nonprofit leaders meet, and I know you all meet, and other committees meet, and there's a lot of meetings that happen. So the more that all of these efforts can be coordinated would be really great. And I'm hearing all this data that you're trying to gather, and I think the more that can be streamlined and unified, I think my understanding is Youth and Young Adult Services uses Apricot as a system to keep data. I'm forever looking for the best Google Sheet template to keep our own data. Anyway, those are just my thoughts that I've had while I'm listening to you all. And thanks for your great work. Did I answer your need to expand my thoughts enough, Bobby, or would you like me to keep talking?
Of course. No, I appreciate it. Thank you. Good to hear your voice, Ally. Thank you.
Yeah, thanks so much.
So Council Cummings sent me a text and said, I asked him a question. He said yes, and the question was just simply, can we discuss the agenda items so long as we don't vote? And he said yes. So, yeah, I think we're good if we want to go through the agenda.
Right. I just thought of one more thought. Sorry. I put my hand back up. Is that okay if I say one more? If I
Yes.
spew one more thought? Okay. I just was in a meeting this morning, or I guess this afternoon, and we were talking about crisis services for youth and that there is such a lack of hospitalization, partial hospitalization, intensive outpatient hospitalization for youth in Evanston. And I know there have been a lot of really great talks and there's movement forward to get a living room going, but that's for adults. So I'm hoping that youth crisis, mental health crisis services could be somewhere on the agenda in the future. And my counterpart and I in District 65 were tasked with learning more about how we can implement something in Evanston. So I don't know if that's something that anybody in this task force could help with or would be interested in, or who I might start talking to see what already has been done and then what we could add to that. Does that make sense what I'm saying? Mm-hmm.
It absolutely does. And Illinois is a particular gap in that area.
Yes.
I would be happy to connect you with some folks that are working on this at the state level.
Oh, awesome.
For implementation. We've hit some roadblocks as a state, but continue to sort of work through that. And I can send you my contact information. I can try to connect you. Is that
That would be great. I'm putting my
Okay,
email
yeah.
in the chat as we talk. My son is also trying to get my attention. Harnett@district65.net. That's me.
Perfect.
All right. Yeah, we've talked to some people at the state level too, and I know they have been doing kind of an overhaul of SAS, but I haven't heard where that's at.
I will
So I'd love to hear more from you.
Yes, I will share some information with you. I think that it is still in flux.
It's very much in flux. Yes. Yes. Well, we should at least be able to do as well as Wisconsin, I say. I'm from Wisconsin. I can make fun of it.
I work in Wisconsin, so I get you.
Okay, right? Yeah. All right. Thanks so much.
Thank you so much, Allie. All right. So we've gone through. Is there anyone else who would like to make a public comment? All right. We can't do that. We've done the Zoom grant supporting support services was the next sort of just discussion. But we wanted to discuss the idea of forming a working group. And I think specifically the reasoning was, as we think of, so we voted last time as a committee to focus support service funding on mental health. And that is, I think, sort of what that looks like. We probably need to have further discussion and sort of thought process and some recommendations on just how to implement that. And the thought might be that a working group could do some of that research and come back to the full committee. Sarah or Jessica, did I miss anything there?
I think that's spot on.
All right. But that would be official action. So that was just sort of the thought process of, and so maybe we can just, those of us who are on, if you have time in the next month, your own, doing your own sort of research or thoughts on how that might look in terms of implementation. Maybe come prepared for a discussion at our next committee, because it is sort of an open question. We as a committee absolutely believe we should focus on support services and mental health, as was voted on last time. But what does that look like? What is that funding model? That is the question before the committee, I think, now. And I think for those of you who are in the public, I think providing, comments next time would be helpful too on that particular matter. And then we'll also have to review applications that sort of don't fit under case management or safety net services, and make action there as well. And then Jessica, we've already done the staff report. Is that correct?
Yes, the only other thing that I wanted to add in the staff report is that I sent around information about the point in time count, which is coming up in February. So if anyone would want to volunteer, I have not done it. Sarah has, but I hear it's very worthy. It's a very worthy endeavor. And otherwise, I'm done with staff report.
And the point in time count, just so that everybody knows, is mandated by HUD. And it's their way of trying to really quantify the homeless population. And the protocols, I'm sure, will be very different from prior years, because of course in fact, it was already pushed back. Normally it's in the last week of January, and you have to get HUD permission to move it. And I believe it has been moved for all of the continuum of cares, or the continua of cares. One of the things that a lot of us find frustrating is, we kind of think that sometimes they're trying to make sure that we don't count as many people, because how many people who are homeless are going to be out at night in January? Many of our people who are homeless are smart enough to try to find ways to stay warm and not be found. So I honestly think that it results in an undercount. Of course, they do count all of the people who are in shelters and have connections with agencies. So there are a lot of different ways that it is counted, but it is, they will be forming teams. And in the past, what we've done is we've been put into teams, and we go to certain areas and drive around or walk around, depending on what it is, and just try to find out who's there and who's homeless. And I think that there are some changes, as I say, to the protocols, but it can be an interesting. One year, the team I was on included a gentleman who had been homeless in Evanston for 10 years, but was always working. And we were with a connections staff member who, this was a number of years ago, who isn't there anymore, but the man who had been homeless and was recently housed was saying, "Oh, we should go here and look there." And we're all like, "Really?" And he was like, it was just really interesting how resourceful people are. And, it really, I developed a admiration for the resourcefulness of people who have nothing, trying to stay warm and dry. On that particular night was raining. It was, one of those upper 30s, low 40s, and raining, and it was just really horrid out. So, but we did find some people, and it was largely because of this gentleman knowing places that people could get under roof, but that I never would have thought of. So. And I think that if
Derek, you had your hand up at one point, but was it?
I was going to ask more about the point in time, but Sarah.
There we go.
Elaborate. So thank you.
Sarah had a wonderful overview of it.
Well, we can send you information on where to, how to sign up to, if you want. But it is. We can shoot that out. Anna has just said she's going to volunteer. So, and it'll be February 9th. That probably everyone will meet at about 8:30 in the evening, and then that's how it works from there.
Yeah, could you send out Sarah, or anybody, just information about that, more about
Yeah,
that?
we'll just send you the link and to everyone in the committee, just so that you have it, and whether, yeah, absolutely. In fact, the thing that made me think about it is, I will have to find it in my emails, but we will get it out tomorrow. They just sent this out today, and I was like, oh, we ought to tell the committee about it, because it is something, it is important. And it is a major part. One of the challenges is they count all of suburban Cook County, and it's, it's not, you really can't do it by community, but we do learn indirectly, even though we don't try to literally count by community, we can provide some feedback on what was found usually, so, or how many people were found and stuff. So we will send that out. Absolutely. Anything else? And Ally, I will send it to you too.
Oh, all right. So then we will end this.
We will
Gathering.
disband. Huh?
Yes.
When's the next
Thank
meeting?
you all. Stay
Sorry.
well and warm.
It is February 10th, because we're back to our second Thursday schedule. We pushed it back 1 week this month because it didn't give anyone any time to get, because even the schools weren't even back in session until the second full week, just because of the way that, it just, so everybody's schedules were kind of different this year. All right.
And I think the sooner we can get that Google Calendar out to everybody, the better for the 10th. Just so they know well in advance that we're meeting on that day.
Sure, I will work on that.
Thank you.
All right. Thank you. Thank
Night,
you,
all.
everyone.
All right, everybody.
Good night. Thanks again. Bye-bye.
Thank you.
Thanks,
Good night.
everyone. Good night. All right. I'm ending.
We're the last two.
Yeah. Okay, bye.